Hey there, Sterile Processing Universe. I'm Brandon from Beyond Clean, and I want to welcome you to the Beyond Clean Mailbag Series video, where you put us on the spot with your questions. If you've got a question that you want us to answer, there's a few ways you can send it our way. You can send us a message to Facebook or Instagram using the handle @BeyondCleanPodcast. Or you can send us an email to info@beyondclean.net. If you want your question to be featured on a Mailbag Series video, make sure you type mailbag into the subject line of your email or into the body of the direct message on the social media platform. With all that said, let's get to this episode of Beyond Clean Mailbag.
Hey, Sterile Processing Universe, we're back for another edition of the Beyond Clean Mailbag, and we've got an interesting question this time. Do you think that sterile processing technicians should be paid the same as surgical technologists? And let me kick it over to Mike to start us off.
Yeah, so this is a loaded question, and there's a lot of room for debate. I tell you, I don't have an easy answer to this one. What I want to give you is probably an informed non-answer, which basically says we don't have enough data on the risks that improperly processed surgical instruments poses to patient health to be able to grade, whose contributions matters more. I would love, ideally, if we could say, listen, a bad sterile processing technician has a 20% chance of harming patients versus a bad scrub tech who has a 15% chance of harming a patient. And because of that, sterile processing gets paid more based on risk mitigation. And I think that would probably be the best way, is that if we had some sort of objective data that could justify different pay scales. We don't have that right now. And so what ends up happening is it's based on the perception of expertise from administration. It's up to us as sterile processing technicians to raise our contributions and the visibility of our contributions if we want to achieve equal levels of respect.
What do you think, Brandon? You were a surgical tech, right?
I was, yeah. So this is a loaded question, and it's very tricky. And my gut says to say yes, but at the same time, surgical techs, they have a lot of responsibility for the types of the procedures they're doing, and they need to learn the instruments to a certain point. They need to know medications and patient positioning and all that kind of stuff. And then you have sterile processing, where we're learning the cleaning, disinfection, sterilization of instruments. So there's a lot of science for that as well. I would say one thing that the surgical tech career field has over sterile processing right now is they're very professional education focused. So I have yet to see a hospital that is hiring a surgical tech with absolutely zero experience off the street. So I feel like our industry is at a disadvantage right now because we don't require professional education. We have a lot of on-the-job training, people coming off the street. We have a lot of techs that have spent 10, 15 years in the field who think they know a lot of things about the job, who it turns out maybe don't know exactly what the standards are saying and what's supposed to be done. So I feel like if it's a great tech that has some professional education, I think they should make the same. But I think as an industry, we have a lot of work to do to push that professional education forward. It's important for us to prove ourselves to those administrators who are actually setting those salaries, to Mike's point. So we need to be the educators. We need to rise up. We need to reach the bar that we're setting salary-wise and prove ourselves to achieve that.
So I always want to look at what's going on behind a question. And I feel like what's going on sometimes when we talk about us versus another professional group, that maybe what's going on here is we're trying to establish some sort of like pecking order or like some sort of hierarchy where people are respected, their contributions are respected more or less based on what they're contributing to the case, or maybe based on what their pay scale is in this particular case. I mean, the flip side of this is, okay, let's just say SPD does get paid more than scrub techs. Does that mean that scrub tech contributions to patient outcomes all of a sudden don't matter? Like, well, no, not at all. So what I really would like to see is, regardless of pay, that everybody's contributions to that outcome of the patient is considered equal in the sense that they all matter.
Yeah, I'll add that there's not going to be a more outspoken group of compensation advocates than here at Beyond Clean. So this question, as you guys have outlined, I think pretty well, it gets to a part of that compensation issue, but it doesn't really get back to the part that we focus on is, whatever the technologists are getting paid, the technicians in sterile processing are not getting paid enough. So we need to focus on the data that's going to drive that conversation forward. And Brandon, I think you made a good point. Actually, Mike, you might have brought this up as well, but I think where these surgical technologists have succeeded is in how they have lobbied for this legislation around the United States, for instance, for what is required to become a surgical technologist. And even perhaps in the language that is used. I know a lot of folks who are surgical techs don't like to be called a surgical technician because the connotation with technician and technologist in their mind are vastly different things. I even saw it was a post on LinkedIn. This is actually talking about, I think, radiology, but it was like, we're not radiology technicians, we're radiology technologists. And the difference they gave was, one pushes a button and the other understands why they're pushing the button. So, this is talking about compensation, but it goes back to how are we lobbying, how are we presenting ourselves professionally to administration, to your point, Mike. How are we advocating for the public acknowledgement of our contribution to safe patient care? And how are we developing education programs, to your point, Brandon, that can feed, even if we raise the standards today, there's not enough schools out there, programs out there to provide the industry with folks that are trained right out of the box. So, yeah, they're not simple answers, but it is a very important question, not only comparing us, to surgical technologists, but also to everybody else that contributes to what happens in that OR room.
Mm-hmm.
But that's a great push for the education system as well, Hank. So there isn't enough schools out there. But I know there's a lot of sterile processing leaders, technicians out there who want to train new techs, who want to fill that role. So I would suggest if that's something you're interested in, reach out to your local college. Maybe you can start up a sterile processing program within your local geographic area. And the more we build, the more we lobby, the more we can raise this industry up together.
Here at Beyond Clean, we are privileged to bring you excellent sterile processing content every single week. If you're new to the channel, please hit that subscribe button so you don't miss a future video, and hit that like button to let us know you appreciate the content. If you've thought of that question you want to send our way, here's the ways you can hit us up. Thanks for watching and spending time with us, and we'll catch you in the next video.